Hello everyone. Today we are going to see about the final resources. What are the books you need to follow for your final Mbbs? So the first is general medicine. So in general medicine we have three books. One is Manipal, one is Harshit Balur, and is Davidson. The thing is, Manipal is very easy book. You can study this book within 3 months of time. Harshit Balur is a medium range book. You can study this or you complete this book within 6 months. Davidson is a book which you have to study for at least 8 months because it has a lot of concepts and it has a lot of explanation. But the thing is, Davidson is purely like an English author book, so it doesn't have more of content. It has more of what to say, how to learn medicine. That's the way Davidson is. So most of the people will say study Davidson because for you to understand some concept, Davidson will be good. For other thing, for example, in infectious diseases and in your cardiology, in rheumatology, these topics and nephrology and all, it's not good because they have limited amount of content. But the point in Davidson is, if you study that, you have a better understanding. But the problem, you have to study for a longer time. It will take more than 8 months to understand what is in this. But Harshit will not a book like this. It will like spoon feeding. Like it will say what are the common points you need to know. It will be purely focused on what are the things you need to know in a university exam. What are the things you write in a theory. So this book I suggest for your theory. If you don't have that much of time, because you guys have ENT after in your final year, so you have limited time, so you can go with Manipal is a book where you can understand medicine. You can know, okay, this is how medicine will be there, these are the topics will be covered in medicine, so you know a basic general overview of that. If you are not going to take general medicine as your post graduation, you can use Manipal. Or else you want to take general medicine as your post graduation, you can go with Harshit Bhatt because it will be very helpful for your internship as well as for university exam, as well as to understand your medicine concept. Okay, ma'am? So next we have general surgery. General surgery is, there are three books, but I will suggest to get SRB. Most of the authors follow SRB. Most of the faculties, most of the people will follow SRB. But some people will say, like, if you go to a clinic rounds, they will say Bailey is a good book. But I would personally say don't use Bailey because it's not a costly. The problem is it has lot of explanation which is we can't understand in a way, because surgery, even SRB, you can't understand. You need someone to guide you. For example, marrow faculty, or it can be prep ladder, it can be any person, anyone need to guide you. Surgery is not a medicine subject like you have done previously, because surgery is very new to you. Because in medicine you have already learned the pathologies, the treatment part, pharmacology will be there. Path, pharm, micro, the three things will combine as your medicine. But surgeries, you have only bit of surgical knowledge, that is by your anatomy only. So surgical knowledge is different, so for that someone has to guide. So that's why I'm saying getting SRB is better to ace your university exams. Manipal is also better, but these two are equal. Some universities follow SRB, some universities follow Manipal. But most of the time SRB is a better book to write your content. Manipal is also same thing. It has an equal proportion. You, whenever whichever book you want, you can buy. But I don't advise Bailey, because Bailey, if you want to start reading abdina, you have to start it from your third year onwards, because then only you can understand what are the things, because it covers artho also. So to understand any concept in Bailey, you need a lot of time and you have to take notes. So that's why I'm saying for this point of time, at the point of time, you will be mostly in the 3 months, 2 months have be gone in your final year. So go with SRB and Manipal is very idealistic. So that's why I'm saying go with SRB. But Bailey and Love, if you are interested, you are going to take surgery abdina, you can read, but step aside for the book which have some notes or any platform to help you, because even toppers can't able to study Bailey as resource, because it's very hard to study and understand the concept. You need someone to guide. So for university purpose, SRB. If you're going to take, you want to ace your NEET PG or something, Bailey is a good book with the guidance of Marrow Prepler or something. Okay, ma'am. Why I'm stressing is this, because some people will buy Bailey and they didn't study that book. They then again buy Manipal for 3 months or 4 months. They will study in that. That's the same thing. Please don't waste your money. Use the money in conservative. If you're going to need for preparing for NEET PG now, it will better to go with Marrow notes, because it is a full notes which is crisscrossed by Lohan Karanwal into a concise material. It is actually a better version of Bailey, I would say, rather than. Okay, so next we have OBGY. In OBGY, the main book is Mudaliar and Menon. It is very easy book. It's a OG itself is little bit easy. And Gynec we have Shah. Shah is another one book is there, but for gynecology, Shah is way more better than other book. You can study in Shah because in Gynec there is amenorrhea, tumors, infection, prolapse. These are the common topics they will ask, and urogynecology. So these topics you can treat anywhere, but infertility is actually extensively given, and it's very good in Shah. I would suggest. So go with Shah is better. But if you are not finding difficulty in Shah, you can buy another book also. But I don't know the name of that book. You can use Mudaliar Menon for clinical apps. There is no other book. It's very easy for you. Shah maybe some people will say, but some other book is there. I don't know what the book is, but my suggestion is Shah. So then is pediatrics. Pediatrics is a short subject, so it is very easy to understand because it's systemic pediatrics will come under medicine. Only you have to study neonatology and general pediatrics, that's the growth and development, nutrition, that and all. So for pediatrics per se, OPGY is the best book. No other book is there. If some people are saying Mukesh Agarwal is the best, but it has data flow charts and something, but I don't see people will ask questions from Mukesh Agarwal. Most of the people have they will ask questions from OPGY only, because OPGY is the book most generally PGs will use, like even postgraduate people are using. Nelson is a reference book, it's not a main book. Because why I am saying this, Nelson is a different aspect of understanding the pediatrics. If you're going to take post graduation, you can take Nelson, but you are going to appear for a university exam, OPGY is way more than sufficient. It is very easy to learn. If you take notes now, it will be more than sufficient for university exam. You can complete this book within 2.5 months if you study 1 hour per day. All books I am saying, you need just 3 months, 1 hour studying, you can complete all these books, every topic, each and every page you can complete. So in that you will understand with what are the things are important for you. Then the ultimate resources, obviously Marrow and Prep Ladder. I would say Prep Ladder go with medicine, not other subjects. In Marrow you can use surgery, OBG, orthopedics, pediatrics. So these 4 subjects are good in Marrow, so you can use those. ENT Aftal also good, so you can use that also. For ENT Aftal I will put in another video for the 3rd year resources. Okay, I can't cover in this, so I will put another video. So whatever you do, if you don't understand a subject abdina, first what you have to do now, go with videos. They will tell you what is happening in each and every system. For example, if you take surgery, abdomen, sir, I can't understand abdomen. Okay, they start from the beginning. Okay, for example, they start with esophagus and stomach. They will tell you, like, in esophagus what are the conditions are there, how esophageal disease will present. Okay, in surgical manner we have medicine and surgery, because there is a big overlap between medical gastro and surgical gastro. For example, if a patient is having liver cirrhosis, that patient will develop esophageal varices. That condition can be, nowadays it is treated by both of them. Surgical gastro can also treat medical gastrology also, because there are endoscopical procedure to ligate gastrial varices or esophageal varices. So that thing is, you can study it from medicine also and surgery also. For that you need to understand how it works, like how esophageal varices is working, like how the disease progress. What are the things we will do, what are the treatment modalities. It will have surgical modality as well as medical aspects. Okay, so to understand those things, it will be very complicated if you directly go to the book. So if you go to a video, they will tell you exactly. But for an understanding level, for you want to pass your exam or to your university exam, you can directly go to the book and study this and have a general overview. Okay, this, if esophageal varices come, I will give beta blockers, octreotide, these kind of medications I will give. I will do some endoscopic procedures, ballooning, some other we will do, and I will stop the bleeding, and I will post the patient for hepatic liver transplant, hepatic transplant, orthoptic liver transplant. So depend upon the topic, it varies. My suggestion is going with video, then understanding the subject, then going reading this book is way more better than anything. For example, if you don't have time, you don't have enough time to study, see videos அப்படின்னா, you can directly go to the book, understand the important question, study those important questions, take a notes, have a revision. This will be helpful for university examination. Whatever the university, take the previous year questions, write those previous year questions, practice those previous year questions. Those previous year questions will give you a idea of if any new questions come, that will be easy for you, because you have already studied the 80% of your content. Balance 20% is depend upon what are the 80% you read. You can write story depend upon those 80% of content. Okay, thank you, bye.